अस्सलाम वालेकुम एवरीवन। सो आज मैं आपसे कोई टॉपिक डिस्कस नहीं कर रही, बल्कि मैं आपसे एक सक्सेस स्टोरी शेयर करूँगी। आई नो कैंसर रिलेटेड डिस्कशंस कैन बी रियली टफ समटाइम्स, लेकिन वी डू हैव सक्सेसफुल स्टोरीज विच आर एक्चुअली रियली इंस्पायरिंग. So there is one of my patients who had cervical cancer, and she came to me like 2.5 years back, and she was actually treated in a very reputed hospital, far country, and she had surgery for her cancer at that time. And she was at in fact a year ago, यानी कि मेरे पास she came like 2.5 years back. So 3.5 years back she had a surgery for cervical cancer. And at that point of time, the doctor advised her some radiation and some chemotherapy, or maybe was not advised. So there was some misunderstanding, but she didn't have any treatment after surgery. So after a year, her cancer came back at the area from where it was removed. So, when she came to me, she had pervaginal bleeding. She was in a lot of discomfort and pain, and looking at her scans, her disease was quite advanced. उस वक्त pelvis में भी बहुत बड़ा सा mass था, lymph nodes भी involved थे, but fortunately she didn't have any spread to other organs of the body, so it was still confined to the pelvis. So when I met her, she was having lots of symptoms, and her family was really devastated because they told me that when they had surgery done, they were told that she is cancer free now, and the chances of it coming back are really minimal. So how come it came back after a year? So I sat with them, I counseled them, and then we discussed the treatment. So I recommended them 7 weeks of treatment, जिसमें 6 weeks of radiation थी, or some cycles of chemotherapy according to her age, like she was 70. So I had to keep that in mind. So she was suggested 6 cycles of chemotherapy combined with radiation, and then she was advised a specialized treatment which is called brachytherapy, which is internal radiation after completion of radiation. So she completed her treatment, जो कि 7 weeks का treatment था, and during the initial 2 weeks her symptoms improved really well. Her bleeding stopped, her pain improved, and she became very active. And when she reached towards the end of treatment, obviously the treatment was a bit tough. She had some skin reactions, a bit of a diarrhea, but she cooperated, and we managed in the best possible way. And almost 2.5 weeks after completion of the treatment, she was up and about like any other person of her age. And then we had her first scan done after 6 weeks of completion of treatment, and it was all clear. And then she had a PET scan after 4 months of treatment. Again, it was all clear. She comes to me every 3 to 4 months. I do her internal examination, which is all well. And then yesterday she came to me, and she came with her second PET scan that was done 2 years after treatment, and mashallah, it was all clear. So I was really happy to see her, and I pray that her coming scans, they're also good. So all I mean to say is that yes, cancer treatments are difficult, but you have to cooperate with your doctor during the phase of treatment. And and most of the treatments, they work really well. So we do have survivors, and even with a recurrent disease. So like this patient, she had a recurrent disease, and she, mashallah, is cured. So the message is that don't lose hope. The hope should stay alive. So thank you very much.